but
Okay.
yeah.
All right. So we're going to talk about what was
I will
found.
film, no problem.
So, sure.
Yeah, because I want to remember.
And I'll give this to you.
Okay,
yeah.
good, yeah.
So when we're talking about uterine cancer, there are several things that we look at to determine if there's anything that needs to be done after the surgery. Okay. And the first thing that I'll tell you just right out of the gate is I see no indication to give you chemotherapy. Okay, so we'll just get the good news out of the way. We won't make you hold your breath to hear that. Okay? Yeah. All right.
Thank God.
Yeah.
Yes, this is a very good news.
It is.
Yes.
It is. So when we're talking about uterine cancer, there are kind of two broad categories of the type of cell that can be involved with uterine cancer. And so one of them is kind of more aggressive and the other one is less aggressive, and you have the less aggressive type. So it's called an endometrioid cell, okay? And then there are some other more aggressive types, serous, clear cell, carcinosarcoma. You don't have any of those, all right? So this is called an endometrioid uterine cancer. And then we look at what's called the grade of the cell. And so what that means is how aggressive do the cells look underneath the microscope. So there's grade 1 and grade 2, which are both considered to be low grade, okay? And then there's grade 3, which is higher grade, and you were grade 2. Okay.
Almost there, yani. Alhamdulillah, but I came in the right time.
Yeah.
Yeah.
Now the other thing is when we're looking at uterine cancer is we want to know how far into the wall of the uterus did the tumor invade. Okay. Yours actually didn't even invade into the wall of the uterus. Okay. So it was very, very shallow. All right. And then we want to know how many lymph nodes, if any, were involved, and you had 0 lymph nodes involved. All right. The other thing that we look at is something called LVSI, and what that means is lymph vascular space invasion. And so is the tumor, you can just LVSI. Lymph vascular space invasion. And so what that is the tumor invading into the small lymphatic spaces and the small blood vessels that are surrounding it?
Yeah.
Because that's a bad prognostic sign, and those have a tendency to be a little more aggressive and have a higher risk of recurrence, and you were negative for that. Okay?
I feel that God loved me.
So I agree.
Yeah, really. Yeah.
I agree. So when we look really, kind of at all of the features of your cancer, this was a very non-aggressive cancer, and it's a very early stage. It's a stage 1A cancer, and that's about as early a stage as you can have. Okay?
Oh my God.
There is only one piece of this that we don't know yet. So we do some molecular markers that also give us an idea as to kind of the aggressiveness or non-aggressiveness of things. For a stage 1A cancer, they don't really color how we think about the cancer. So for more advanced stages of cancer, stage 2 and 3, the molecular markers are a little bit more important. But we don't have the results of that back yet. Okay. And then there is one thing also that we look at, which is called the MMR status. And that also is a particular kind of molecular profile. And you can either be what's called DMMR or PMMR. Okay. DMMR tumors are a little bit more aggressive, okay, or can be. PMMR is not so much. And this was the one thing. You were a DMMR, okay? Now, for a stage 1 cancer, that really does not mean a lot, okay? If you had a more...
I'm losing track here. If you could
So,
just back up a little
so all I'm saying is that there are some molecular markers that we look at, okay? She has one molecular marker that suggests that this may have been a more aggressive type of cancer, okay? But when we weigh that one piece against all of the other positive pieces, it really doesn't it really doesn't mean anything.
Yeah.
Okay?
Yeah.
When you say aggressive, meaning that it has a tendency to spread?
No, I just mean what I'm trying to tell you is that if you look in her chart and you see DMMR,
Yeah.
I would kind of ignore it.
All right.
Okay.
Okay.
But I mean, in terms of when you say aggressive, how do you define that exactly?
Increased risk of recurrence. Not necessarily increased risk of spread, but increased risk of recurrence.
All right.
Okay. So that's one feature. That's the only kind of, negative feature that your tumor had. Okay. Now, for a stage 1A low grade cancer, we have two options of what we could do. We could do nothing and just watch you closely. Okay. Or the other option would be is that we could consider a course of radiation, okay? And it's something called vaginal brachytherapy, which is, it's usually somewhere between 2 and 5 radiation treatments that's given internally to the vaginal cuff region, okay? The vaginal cuff is kind of where, at the very end of where the uterus was and where it connects to the vaginal canal. And the reason that we sometimes consider doing this is that this is an area where it's probably a higher risk that the cancer may come back, okay, is in that vaginal cuff area. So sometimes we give radiation just to that area as kind of an insurance policy to kind of protect that area and decrease the risk of a recurrence. Although your risk of recurrence is very, very low. Okay. So I would suggest that we have you meet with a radiation doctor just to kind of go over with you whether or not you should get radiation. Okay. And so the two situations for a stage 1A uterine cancer where we consider giving radiation versus just watching the cancer are if you have a lot of this LVSI that I was talking about, which you didn't have any of, or you're above the age of 60, okay? And you're 62, right? Okay. And that's only because women above the age of 60 with some types of uterine cancer are at a little bit higher risk of recurrence. Okay. So age does play kind of a role, in that recurrence risk.
And what other factors play?
I gave them all to you.
No, I mean, what other factors come into the recurrence?
Those are the ones that I already went over. That's what you just wrote down. All of those other things. So that how far into the uterine wall it goes, the LVSI, the molecular markers, the lymph nodes, the type of cancer. So those are all things that we look at to help us determine, kind of the overall picture. So your overall picture is very, very good. All right. And we should just have you meet with the radiation doctor. It's not my decision whether or not to offer you radiation. So they'll kind of go over the pros and cons with you as to why to do it versus not why to do it. Okay. And then you can make a decision as to whether or not that's something that you want to do or not. Okay. It would be perfectly reasonable to not do radiation, I think, in this situation. But they're going to give you some numbers, that might kind of, push you one way or the other in terms of, helping you to make that decision. Okay. But the overall picture of your cancer is very, very positive.
Alhamdulillah, thank you.
Okay.
Yes, thank you, Dr. Gail.
Yeah. So this is it's all good news for you.
Thank you, And the way you explained it is so satisfying, so soothing, so calming. And thank you for all this information. I really appreciate. Thank you, Dr. Gail.
Absolutely.
Yeah, thank you. Now at least we have
a picture.
Picture of what's,
And in terms of how often to see you and follow you, so typically we would recommend that you're seen every 3 months, and for those 3-month visits you should have a pelvic exam. Okay. And that pelvic exam should include a speculum exam, which is where they put the piece of plastic in that opens up so that they can see. Okay. And then what's called a bimanual exam, which is the finger exam, where they go into the vagina and then feel around for any nodules. And then a rectovaginal exam, which is one finger in the vagina, one finger in the rectum.
All right.
Because that allows us to feel the back of the vaginal wall. Okay. So that's the type of exam. And then also examining the inguinal or the groin lymph nodes. Okay. talking to you about any concerning symptoms you're having. Are you having any abdominal pain or bloating? Are you having any vaginal bleeding? You know, any spotting, anything like that. That should be done every 3 months.
All right.
And that should go on for the first 2 years after. And then you can start being seen every 6 months once you get to that 2-year mark. And you would do that until 5 years.
All right.
Okay.
Okay.
You don't need any lab work done.
Okay.
And we generally, for a stage 1A, we don't do any follow-up imaging, you know, CTs or anything like that, unless you were having a symptom.
Yeah.
Okay. So if you were having abdominal pain or bloating or vaginal bleeding or anything like that, that is when we would recommend that you have a CT scan done.
Okay.
Okay.
Are these instructions all gonna be?
I can
written
put
down?
them in the note,
Yeah.
so that when you guys go home, that they'll know exactly,
yeah.
what to do. Absolutely.
And Dr. Gail, since the operation,
Yeah.
I feel the gases. Before I don't have this.
Mm-hmm.
It's so. Sometimes I can't even sit on the stool.
Mm-hmm.
It's so painful. It's like something poking my belly, just like that.
Are you moving your bowels okay?
Sometimes, yes.
Mm-hmm.
Like 3 days in a row, I'm okay, and 2 days, no.
Okay. Are
2
you taking
days,
any type of stool softener?
No, I'm
So-
taking prunes.
Oh, that's fine.
Yeah, hot
okay.
water in the
Yeah,
morning once I wake up.
Yeah. Okay.
Yeah, to move my bowel.
Okay.
Yeah.
And are these symptoms gonna?
They should
Go away at
improve.
some point?
They should, because you've had a lot of kind of things displaced in your abdomen. So there was somebody in there kind of monkeying around with things.
Yeah.
And then also when you take the uterus out, it takes a little while for things to kind of find a new home. For things to kind of settle down. So it's not uncommon that people do have some trouble with their bowels and some trouble with some gas pains and things like that after having a major surgery like that.
And for the moment, how do you advise me, Dr. Gay, for my movement? I walk and things like that.
Yeah, I mean, I would say just to keep doing what you're doing to stay active. The surgeon did they tell you when you could that doesn't come from me. So when you can lift, usually they put you at just like 5 pounds right now for the first 6 weeks or so. And then if you're feeling okay, then they will typically lift those restrictions. In terms of, did they talk to you about that piece of it? Okay, yeah. So just follow those instructions.
Dr. Raya, yeah, she said.
No, both of them.
Oh, she said, yeah. She told me to walk, but I don't know how fast, how slow. It depends
it's really
on
based
me.
on you. Yeah.
All right.
So
Okay.
if it's causing you pain, stop doing it.
Okay.
So we don't want you pushing yourself too hard right now, because eventually, you'll be able to. But if it hurts, stop doing it.
Okay, I will.
Okay.
Okay, Dr. Gay. Thank you. Now for this one,
Yeah.
we went to the
To the ear.
they took my blood today, and I came without having the band around.
Okay.
So do you think that we go back to Dr. Raya?
No, I think it looks okay. It doesn't look infected. They wouldn't do stitches or anything at this point anyway.
This is the mark. This
Yeah,
for the nurse.
for the redness, yeah.
She told me once you see redness spreading. So the white is okay.
The white's fine.
Okay.
Yep.
Okay.
Yeah.
Okay.
That's not a sign of infection.
No, red is a sign of it. No, it doesn't look like that. If it was pus, it would be much more swollen. Obviously, watch it, and if it changes, but it doesn't look like pus to me.
Yeah. So we are good. Yeah.
Mona dying, so we scheduled my
Dr. Raya?
radiologist.
So I
I
will
don't
put a
know.
referral through in for
Yeah.
radiation oncology. Do you want to meet with a radiation oncologist?
It depends on you, Dr. Gale. How?
Well, I always recommend that people, meet with a radiation doctor. But I don't know what your travel plans are. Did you have plans to leave and go home? What is that looking like for you?
Yeah, it's still because I am not that strong.
Yeah.
To get into a plane like 17 hours. So I think until the recovery, like 1 month more.
Okay, so you'll have
I
time to
guess.
meet with a radiation
Yeah,
doctor. Yeah. So I'll put that referral through, and then they will contact you to make that appointment,
Okay.
and then they'll talk with you about all of these pieces. Okay.
Good.
And then you can decide if that's something that that you want to do, or if you're comfortable just with observation. And again,
Okay.
I think either would be a reasonable decision.
Okay.
So